Hey, good people, welcome in. This is Psychology Noir, and I am Dr. Lund. We are back talking about the Letecia Stauch case, where this woman is accused of murdering her 11-year-old stepson, and she is pleading insanity. The trial has continued on and will probably go on for the next few weeks at least. And what I'd like to do is take a look at this insanity defense and talk about the diagnosis that her defense team states that she is impacted by, which is dissociative identity disorder, or better known as the acronym DID. And if you're new to the channel, please consider subscribing, liking, and commenting. And if you are a returning subscriber, thank you, welcome back, and please like and leave me a comment on your thoughts. So, what we've watched so far in the trial is some pretty interesting things that continue to be in alignment with my reaction in a previous video about what I noticed about Letecia while she was giving an interview to the press. Very me-oriented, spoke very little about, at that time, her missing stepson, who obviously she knew she killed. And as we watch and listen to phone conversations with her, well, now her ex-husband, who was Gannon, the child who was murdered, his biological father, as well as watching her interrogation at the police department and her sort of feigning a heart attack, having to be taken away via ambulance, not staying for an examination due to claims that she was sexually attacked, and all the varying stories about what happened during the period of time that Gannon went missing, which to me initially looked like some combination or type of personality disorder, and it still does from what I've seen so far in the trial. But let's talk about dissociative identity disorder. Now remember, personality disorders such as borderline personality, antisocial personality disorder, narcissistic personality disorder, those would not qualify for an insanity defense. An insanity defense has to constitute a mental disorder where the person at the time of the crime was unable to determine right from wrong. So those personality disorders do not qualify. However, a dissociative identity disorder, which is DID, it was formerly known as multiple personality disorder, and it's basically a complex mental health condition where a person develops two or more distinct identities or personality states, each with its own perceiving and interacting abilities with the world. The identities may have their own unique names, histories, mannerisms, and they take control of the person's behavior, thoughts, and feelings at different times. Now, this is definitely one of the reasons why attorneys are asking witnesses, whether they're from the police department or investigators, anybody who has had interaction with Letecia, what her behavior was like, if it was a change in behavior. That, to me, is sort of setting the groundwork that if anybody sees some distinct, different behaviors, moods, personalities, that would form the basis of this dissociative identity disorder. Now, in actuality, dissociative identity disorder is really believed to be a coping mechanism that develops as a result of severe and repeating and prolonged trauma, particularly during childhood. The dissociation, sort of being out of reality in a fugue state, serves as a way that the brain and the mind can escape these overwhelming emotions associated with the traumatic experiences, which then allows the person to compartmentalize their experiences and avoid with dealing them directly. Now, some of the symptoms that define DID include gaps in memory or significant changes in behavior, feeling detached from oneself or the surroundings, or feeling detached from friends, family, frequent headaches or migraines, flashbacks to the traumatic period, depression and or anxiety. Now, the condition can be really very difficult to diagnose, and depending on the clinician, some will say it goes unnoticed and is underdiagnosed, while others say it's misdiagnosed and overdiagnosed. So that will be a quandary that will be interesting when the experts for Letecia's mental health, both on the defense side and the prosecution side, they're going to have different takes on whether she has this disorder or not. So it'll be very interesting to see what they have as far as evidence to believing that she has the disorder. And on the other side, the prosecution side, of what that expert witness is going to come in and challenge that opinion of the defense side. So this is really, to me, going to be the key of this case, is watching and listening to the defense expert on Letecia's side talk about how she meets the criteria from the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, otherwise called the DSM-5, which is basically the Bible for mental health diagnoses for psychiatry and psychology. So this expert is going to have to show evidence of how she meets a number of different criterias, and let me summarize those criterias for you so that we can follow along when this expert comes and gives their testimony. So the first criteria to meet this diagnosis is a disruption of identity characterized by 2 or more distinct personality states or an experience of possession, which means that there's going to be alterations in affect, behavior, consciousness, memory, perception, cognition, and or sensory motor functioning. The next criteria is recurrent gaps in memory or recall of everyday events, important personal information, or traumatic events that are inconsistent with just ordinary forgetting of things. The next criteria is a disturbance is not a part of a broadly accepted cultural or religious practice. The next criteria is the symptoms cause clinical significant distress or impairment in social, occupational, or other important areas of functioning. The next criteria is symptoms are not due to the direct psychological or physiological effects of a substance or a general medical condition. something like a closed head injury, or, again, drug abuse. The next criteria is the disturbance is not better explained by other specific dissociative disorders or post-traumatic stress disorder. I think what also is going to make this extremely interesting is dissociative identity disorder is considered extremely controversial for a number of reasons, and is really one of the only mental health diagnoses that carries this controversial label. Firstly, many people in the medical and the psychological fields doubt the validity of DID as a diagnosis. They argue that the condition may be overdiagnosed, or that it may be the result of suggestion or influence by therapists rather than a genuine mental health condition. In addition, there are many professionals suggest that the symptoms associated with DID, such as gaps in the memory or changes in behavior, could be better explained by other conditions such as post-traumatic stress disorder, borderline personality disorder, or other dissociative disorders. Now, within the mental health field, there is ongoing debate about the underlying causes of DID. While some experts argue that the condition is often linked to experiences of trauma, there's disagreement about how trauma leads to the development of multiple identities. Some experts believe that DID is a coping mechanism that we mentioned earlier, that the brain creates in response to overwhelming stress, while others argue that it may be only a product of suggestibility or a learned response. And again, the possibility that it's introduced and influenced by the individual's therapist. So in my opinion, this is really going to be a battle of the experts. And with the heavy weight really on the shoulders of Letecia's expert to be able to prove that she has these symptoms and these altered identities or personalities, that she committed this crime and at the time did not know the difference between right and wrong because it was a different personality that was inhabiting her being when this crime happened. So that'll be interesting. And I certainly cannot not mention the media's portrayal of dissociative identity disorder that's really been sensationalized and inaccurate, leading to misunderstandings about the disorder. Now, some of the movies that have depicted dissociative identity disorder, the first one being probably the most famous one, at least in my generation, is Sybil from 1976, where Sally Fields played a woman, and the story was based on apparently a true story of a woman who had 16 distinct personalities, and the therapist was played by Joanne Woodward, which is definitely one of my favorite movies about DID, although again it's Hollywood's version. Another movie, Primal Fear from 1996, with Edward Norton playing somebody who is claiming the insanity defense for the murder of a priest. I won't tell you the ending, but that is a very good movie that really I don't think has gotten a lot of attention. But again, it's with somebody who has apparently a DID disorder. And believe it or not, a lot of people's favorite from 1999 is The Fight Club, where Ed Norton creates a secondary personality named Tyler Durden. as a way to escape his own mundane life. Again, it's Hollywood's version. There is another movie in 2003 called Identity, which has a group of strangers that are stranded in a hotel during a storm. What an ambiance. And as people are being killed off, it becomes clear that one of them may have multiple personalities. And of course, another one of my favorite from 2016 was the movie Split. That had Kevin Wendell Crumb, who was the character in the movie, who had 23 distinct personalities. And I thought that the actor who played him, that I can't think of his name right now, did an excellent job depicting different personalities. Maybe not so much DID disorder, but I think his portrayal of different personalities was definitely intriguing, and I don't know, I thought it was a really good movie. So aside from that depiction of DID, as the trial goes on, as we look at Letecia, granted, you look at some of the pictures I've posted in this video of what she looked like before incarceration to what she looks like now. Prison or jail, any incarceration makes you older pretty quick. So I can't base anything on appearance. However, again, some of her behaviors, without knowing much about her past history, have been intriguing, with her flipping off witnesses during their testimony, which she was confronted by the judge about that behavior. Watching a video where she was being taken somewhere in a sheriff's van and cracked one of the deputies in the head with a Red Bull can. And so there has been some, again, behaviors that you would think under the circumstances, especially with the murder of an 11-year-old child, she would take this as a more solemn situation and not perform, if you will, some of these really inappropriate behaviors. So we don't know if she's playing to the camera and trying to help her defense with the diagnosis, but it's really going to come down to, again, as I said, the battle of the experts, because this is a difficult diagnosis that needs a lot of support and actually, in my opinion, needs a lot of time to be diagnosed. 24-hour period, I think, is really inadequate to make this kind of a diagnosis. So we'll see. We'll see what the defense brings up with past history and how she was diagnosed with DID, and then we'll see what the prosecution's expert brings to the table. So again, thank you all. This is a very interesting and a different type of trial. We know she did it. All evidence points to that. And having an insanity defense, to me, confirms that that's the reason that she committed this crime. So I'm interested to see where we go from here, but I really want to watch these two experts and see what they bring to the table. And now you have criteria to look at to see if it meets, and especially to see what the jury thinks. So thank you all for watching and listening, and please subscribe. I'm trying to get to that 1,000 mark. It's like running in sand in high heels. It's taken forever. So I appreciate you all, and we'll see you at the next video.